Relapsing remitting multiple sclerosis. A 28-year-old woman presents with recurrent episodes of optic neuritis and paresthesia, separated by months of remission. Most likely diagnosis: A. Secondary progressive multiple sclerosis. B. Primary progressive multiple sclerosis. C. Relapsing remitting multiple sclerosis. D. Clinically isolated syndrome. Explanation. Relapsing remitting multiple sclerosis is the most common form, 85 to 90% at onset, characterized by episodes of relapse and remission. Q2. Primary progressive disease. A 52-year-old man presents with gradual worsening of gait and weakness without relapses for 3 years. Which disease-modifying therapy is indicated? A. Dimethyl fumarate. B. Interferon beta. C. Ocrelizumab. D. Glatiramer acetate. Explanation. Only ocrelizumab is approved for primary progressive multiple sclerosis. Progressive disease. A 45-year-old woman initially diagnosed with relapsing remitting disease now develops gradual disability progression with no clear relapses. Most appropriate statement? A. First-line therapies are highly effective. B. Disease-modifying therapies have little effect unless relapses occur. C. High-dose steroids cure the disease. D. Vitamin D supplementation halts progression. Explanation. In secondary progressive multiple sclerosis, most therapies lose efficacy except in patients with ongoing relapses. Q4. Monitory arrate. A 34-year-old woman starts dimethyl fumarate for relapsing remitting disease. Which monitoring is essential? A. Electrocardiogram. B. Chest X-ray. C. Complete blood count, liver enzymes, urine protein. D. Echocardiography. Explanation. Dimethyl fumarate requires monitoring for lymphopenia, liver toxicity, and proteinuria. Q5. Natalizumab risk. A man unresponsive to first-line therapy is started on natalizumab. Which serious risk requires close monitoring? A. Lymphoma. B. Progressive multifocal leukoencephalopathy. C. Osteoporosis. D. Aplastic anemia. Explanation. Natalizumab increases risk of progressive multifocal leukoencephalopathy, especially in JC virus-positive patients. Q6. Pregnancy and multiple sclerosis woman with relapsing remitting disease becomes pregnant. What typically happens to disease activity during pregnancy? A. Increases significantly. B. Decreases during pregnancy, increases postpartum. C. Remains unchanged. D. Always progresses rapidly. Explanation. Disease activity often decreases in pregnancy, but relapse risk rises postpartum. Q7. Breastfeeding considerations. A 30-year-old Walmart acetate wishes to breastfeed. What is the best recommendation? A. Contraindicated. B. Limited evidence suggests no significant risk. Breastfeeding may be protective. C. Must discontinue all therapy. D. Switch to chemotherapy. Explanation. Breastfeeding may reduce postpartum relapse and is not contraindicated with some immunomodulators. Q8. Vitamin D supplementation. A 32-year-old man with new multiple found to have low vitamin D. What is the recommendation? A. Avoid supplementation. B. Begin at least 1,000 IU daily. C. Use high-dose intermittent therapy. D. Only give during relapse. Explanation. All multiple sclerosis patients should receive vitamin D supplementation, although direct benefit on disease progression is unclear. Q9. Walking disability in MS. A 50-year-old woman with multiple sclerosis has peeing impairment. Which adjunctive drug may help? A. Interferon beta. B. Dimethyl fumarate. C. Fampridine. D. Ocrelizumab. Explanation. Fampridine, a potassium channel blocker, improves walking ability in some patients. Q10. Stopping therapy before conception. A 35-year-old man with multiple sclerosis wants to still. What is the recommendation for his immunomodulator? A. Continue throughout conception. B. Stop 2 to 3 months before conception. C. Switch to chemotherapy. D. Delay conception for 5 years. Explanation. It is generally recommended to discontinue immunomodulators 2 to 3 months before conception in both men and women.